My Bump My Baby is the first of its kind. In terms of ultrasound services at home, we're the only ones doing it in the UK, and we're the only kind of like ones doing it to this level in the US. My name's Charlotte. I'm a mother first and foremost. I'm a midwife. I'm a CEO and founder of the whole My Bump My Baby enterprise. I've been a midwife for over 10 years, and within that time I have spanned teenage pregnancy, I've looked after high-risk pregnancies, I have worked within the community, I've done a lot of home birth. So I feel like I've seen a lot of different elements within the maternity services within the NHS. I've then gone to the US and worked for Fortune 200 companies like DaVita, for example, or Kindbody that's up and running, because I went, okay, I've got what I need in the clinical setting, now I need to know how I make this a business. So today we're going to be giving Corey an at-home scan. I think some could argue that there is a lack of compassion in maternity health services, and not by choice. However, with the capacity issues, you start to miss things. No matter where you are, these problems still exist. We have a free NHS service where we have lacking appointments, we don't have enough time for patients. We're in the States where we have privatized healthcare and insurance, and guess what? There is still no space, there is still no appointments, you're still having waiting lists beyond waiting lists. What we've done is we've given you the ability to have that appointment at home. So electively, you can have a 2D scan that lets us see what's happening with the baby, but also give you that reassurance at the same time.
The whole experience with My Bump My Baby has been so wonderful from start to finish. The scheduling was really easy. The technician was wonderful, explaining everything that I was seeing on the ultrasound, listening to the heartbeat and making the experience really wonderful in home and so comfortable.
We do basic checks, so even if we're just doing it for an elective reason, I feel like seeing my baby, that's okay, but we're checking your fluid, we're checking the baby's heart rate, we're checking the position of the baby, we're checking the placental position. If they saw anything that told them otherwise, then they would send that person to the hospital. So not only are we being able to check over the mental health side, but also able to check diagnostically for the basic level. We also have our remote connect feature that lets us connect with anyone, anywhere in the world, friends, family, loved ones, even providers. I envision a space in the future where ultrasound is accessible to all, whether that be by our mobile buses in developing countries, communities, villages, or in low-income neighborhoods within the US or the UK. My main goal is to ensure that pregnant women have the ability to access ultrasound services whenever they want to. I want our company to impact maternal mortality rates. In particular, I want our foundation to allow minority families to seek help faster, and in doing so will really decrease the number of preventable deaths that we have happening within our community. No matter where you are in the world, no matter what language you speak or what culture you follow, if you are caring for a pregnant person, you need ultrasound. It's just one of those things that is universally needed for anybody that provides care for a pregnant person. I want My Bump My Baby to be a household name in ultrasound, not just known for the gender reveals and the baby showers, which of course are extremely exciting, but for all the near misses that could have happened if we didn't get involved. What I really want to be remembered for is my passion for helping pregnant people all over the world.